Good evening and welcome back to KUMSOT. I am your host, Kanisha Leggett, and today we will be talking about safety in the facility, taking an overview of employee handbook safety issues that are passed out from facility to facility. Now, as we know, each facility has its own safety protocol. It is important that you become familiar with your own facility's safety protocol. The employee handbook is a great place to start. I suggest that you not only review the handbook, but you also go ahead and highlight areas or place tabs so that it is easy to find when you need it. The last thing you want to do is need some information from the employee handbook and have no way of locating it. So, after reviewing several employee handbook that are passed out from several facilities, I have compiled a short list of safety protocols that I would like to go over with you today. Now, as I previously stated, they will change facility to facility, so it is important that you review your own employees handbook to see what your facility's safety protocol are with each one of the highlights that I have. Unfortunately, due to COVID, my IT team has been reduced down to my young assistant here who will provide backup while my husband does my recording. So I would like to thank them both in advance. So we're going to talk about facility safety first. The first thing that most times when we think about safety in a facility is fire. And so when we're talking about fire, we want to talk about PASS, which we all know stands for pull, aim, squeeze, and sweep for the use of the fire extinguisher. We also would talk about RACE, which stands for rescue, alarm, contain, and extinguish, a way to confine the fire and rescue your clients. And we also want to note in the facility where the emergency exits are. Make yourself familiar with that. That way, the plan is already in place. Make sure that you know what your facility's protocol is in regards to fire, whether you are to confine your client or move to a centralized location, or whether you are to evacuate the building. It is always best to know the plan in advance. That way, not only safety for you, but also for your client. The next issue in safety we could take a look at would be OSHA and compliance. Now, each facility has their own compliance department, and OSHA requirements are pretty much basic across the board, but you always want to familiarize yourself with them as you start a new employment job. Also, know where your wash stations are. Knowing where your wash stations are located is vital because in the event that something happens and you need to rinse out an eye or a client's eye or rinse skin, you want to know directly where you're headed. You don't want to get lost when a vital time occurs. Next, we'd like to talk about Sharps container. Although therapists don't rarely use Sharps container, it is important that you know where they're located, what belongs in the Sharp container, and how to insert items into the Sharps container. Also, wet floor signage. Wet floor signage is important because it prevents falls. It lets you know when a spill has occurred or cleanup is going on, especially during COVID right now with the massive amount of cleaning that's taking place in our facilities. Wet floor signage is a vital piece of information for not only you, but visitors and clients as well to prevent further injury. Next, we'll talk about PPE. Everyone knows that PPE stands for personal protective equipment. It is vital during this day and age that one, you know how to don and doff it, also that you're able to recognize the various pieces of PPE, and to know the protocol that your facility requires you to wear with each diagnosis. So if we take a look at some of the infectious disease, you want to make sure you know the protocol in your facility for those various diseases. Some facilities do not allow you to bring clients out of the room. They must be room treats when they have those infectious disease. Other facilities will allow you to bring the resident out if they are already donning PPE. So that is very vital. Make sure you know the protocol for your HIV, MRSA, C. diff, COVID, VRE. You want to be informed about these prior to having a client with a diagnosis placed on your caseload. Next, we also like to stress HIPAA. HIPAA is not only important for your client's medical information, but also yours as an employee. You want to know your rights and know that you're securing not only the client's personal information, but your health information as well. Um, know where your medical record bins are located. Oftentimes, you have to print out information or you jot down personal medical information. You want to know where to properly dispose of that information. That way, it's not floating out in the atmosphere. Can you bring that up some, please? Thank you. You also want to know your facility's safety codes. And when I say safety codes, I'm speaking in regards to codes or colors or numbers that are announced over the PA system regarding bomb threat, fire, abduction, heart condition, things like that. When those codes are called over the PA system, you want to know in advance what they stand for. That way you can not only protect yourself, but also your fellow employees and your clients. Employee safety is such a big thing now. Workplace violence, the drug policy, and within the last 7 to 10 years, many facilities have had to update their employee handbooks to include Wi-Fi usage and social media to ensure that they are not only protecting the resident and the facility, but also the employees as well from abuse from other employees or other family members that may be working at the facility or that may be causing abuse, as well as the abuse hotline for yourself or your client. So that is regards to safety for the facility. Next, please. So now we're going to talk directly about what would be considered patient safety. So for patient safety, the first thing that comes to my mind is always the call light. The call light is a patient's safety and their lifeline when they are in the room alone, unsupervised. We know that nurses make hourly rounds. However, in between those times, a patient should be able to reach someone in the event that they are in distress. So one, we want to make sure that not only that the call light is in reach, whether it's in the room or in the bathroom, but that it is also working properly. Next, we want to talk about the wheelchair. The brakes being locked. Often clients go to stand up or sit down and the brakes are not locked and thus the wheelchair moves. Also, making sure that the leg rests are properly positioned and in place and that the resident knows when and when not to stand with the leg rests up so that we can prevent further injury. The other thing we want to talk about are alarms. Some facilities have alarms and some do not. So if your facility does have alarms, you want to, one, know the protocol, make sure that they are on the chair and on the bed if need be, that they are turned on or off at the appropriate times. You also want the room to be clutter free, because when the client arises to ambulate or you are ambulating in the room, you want to make sure that there are no hazards to cause risk, fire, slippage, anything like that. And lastly, you always want to report any issues. If a call light is broken, if there's something wrong that you notice medical change with the residents, report any issues. Do not assume that someone else has either seen the problem, reported the problem, seen an issue with the patient, and already addressing it unless you have verbal communication or written communication that the problem or issue has already been reported. Next. Lastly, we want to take a look at safety with therapy. We want to make sure that the space is clutter-free again, so that when we are ambulating with clients or when they are doing wheelchair propulsion, that there is nothing in the floor to cause an issue. We want to make sure that our equipment is clean and well maintained, that we are up to date on all maintenance. We also want to ensure that we are utilizing gait belts when ambulating with clients or standing with clients to increase the safety and reduce the fall risk. We also want to be trained to recognize medical distress in our clients. As therapists, we should know when there is a medical change happening with our clients, be it increased sweating, heart rate, increased blood sugar, increased blood pressure. These are things that we need to be aware of. We need to recognize not only the visible signs, but the verbal signs, and know whom and how to reach someone to get assistance. Skin checks. Skin checks are also a safety issue. They are not only a nursing or doctor issue, they are part of a therapy protocol. We must check the skin of our clients, especially if we are using modalities, our clients are wearing pain patches, they are using any form of splint, brace, prosthesis. We want to be checking the skin to make sure that there is no irritation going on or skin breakdown. So, skin checks are everyone's job. Next, we want to talk about weight bearing status. This is vital within therapy because weight bearing status must be adhered to. Either not knowing the appropriate weight bearing status or not adhering to a weight bearing status could cause further injury or possible further hospitalization. We should know the precautions and protocols for our hips, our shoulders, our pacemakers. That way, we ensure our client's safety during our treatment process. Also, PAMS, physical agent modalities. We want to make sure that we know all the precautions and contraindications that go along with any modality that we are using. Be skilled and knowledgeable before using a modality. I cannot stress that enough. Make sure you are not only communicating with the patient, but also anybody participating in that client's care, and that you are appropriately documenting when you are using a modality and how you are using a modality. Next, let's talk about slings, braces, splints, orthotics, and prosthesis. You want to make sure that you not only know how to don, doff, clean, use, and maintain these, but your client, the caregiver for your client, and the other staff members all have that information as well. If you feel that your client or the staff is unable to remember the steps, I suggest printing out slips or handouts and placing them in the room or wherever the braces and splints are located for donning and doffing to ensure proper wear, skin integrity, and proper use. Next, let's talk about DME, AD, and AE, durable medical equipment, adaptive devices, and adaptive equipment. It is our responsibility as therapists to make sure that our equipment is not only cleaned and properly maintained, but that we are skilled in adjusting and adapting any device. And that if a device is not functioning properly, that we know who to report that issue to, that it is either tagged or removed from use. Lastly, report any issues. I cannot stress reporting issues enough. Do not assume that the person before you has reported an issue. Do not assume that the person behind you will report the issue. It is your job to report any issue to ensure that safety is maintained for yourself, your coworkers, and your clients. This is my short, brief synopsis on safety for not only our facility, the client, but as well as in therapy. I am Kanisha Leggett. I again thank you for joining me for this safety protocol informative session. I also thank my cameraman and my assistant. Thanks for joining me at KUMSOT. Have a great evening.